Hey friends, this is Jennifer Terri and welcome to my channel. In this video, we will answer the question that has shook every one of us with the travel cap, the reduction of the inbound capacity of NAIA to 1,500 passengers daily. So from 3,000 to 1,500, that's 50% slashed. And as a result, we have canceled flights, rescheduled flights, rerouted flights. And well, this is not new. The inbound capacity has been up and down throughout this pandemic, since this pandemic started. Going back in May 11 until June 10, 2020, would you believe that the inbound capacity in NAIA was only 400 passengers daily? Well, a month after that, in mid-July, the inbound capacity was increased to 3,000 in NAIA, and then 1,500 passenger arrivals, international passenger arrivals in both Cebu and Clark, 1,500 each. As of now, the 1,500 limit for inbound arrivals in Cebu and Clark remains. It's still the same, 1,500 daily each. Why is there a travel cap? Obviously, the first reason is the COVID surge. We see that the cases in the Philippines is so high. They recorded for the last 2 days highest cases since this pandemic has started. It's the highest. So the Philippine government wants to limit mobility, movement of people, to reduce transmission. And despite the stringent quarantine protocols for international arrivals, the Philippine government thinks that we are still bringing in variants into the Philippines. If you can remember, the first case of B117, a UK variant, was from a Filipino who traveled from Dubai. He tested negative upon arrival. You know, when they had that COVID test at the airport, he tested negative, and later they found out that he was positive and he was carrying the UK variant. And after that incident, the hotel quarantine of 6 days, COVID testing on 6th day from the date of arrival has been introduced. We get it. But blaming international arrivals from carrying the variants, it's just, it's like they're admitting to themselves that the current quarantine protocols is not effective. The second reason for the limit of the inbound capacity is that the quarantine facilities are getting full. OWA, they are the government agency that handles OFWs. OFWs get free quarantine hotels. Their budget is depleting, and they're even advising OFWs to postpone their travel. According to OWA's coordinator,
the longer the stay, the higher the cost. Tayo ay nagmamakaawa sa ating DBM at saka sa Kongreso na kung maaari ay bigyan tayo ng supplemental funding. Kasi nga talagang nakikita natin na all year round natin na budget of 6.2 billion dahil sa pag-triple at quadruple ng hotel stay ng ating OFWs ay mauubos bandang gitna ng taon.
So these quarantine facilities being congested, depleting OWA budget, this problem stems from the prolonged hotel quarantine period. So nagpapahirap talaga sa lahat yung prolonged na quarantine period na 6 days. And the effect of that prolonged hotel quarantine period is felt by non OFWs as well. They spend so much money to quarantine in a hotel. The minimum amount that you can pay in a quarantine hotel for 6 days, easy, 7,000, 9,000. Some even have to spend 14,000 and up. Also, the COVID testing, PADLAB, RedCross, they also have to adjust because people are scattered. They have to go to different hotels, and apparently they don't have enough people. We witnessed that problem for one of the stories we featured in one of our videos, because someone had a delay in their testing and she had to beg for PADLAB just to test her and give her results in 1 day. So it is a big problem, yeah. This problem, though, is really felt more strongly by OFWs because they are relying to a government agency whose money is depleting. Could you imagine that for their 1-year budget, it can only last until June? Considering this current restriction of 6 days hotels, at least their budget is only until June. They cannot accommodate for that any further. Even their coordinator is pleading, begging the government to give them more budget. Oh, that's very sad. You can even hear from the news that this travel cap of 1,500 is not mainly because of the COVID surge in the Philippines, but more on the congested quarantine facilities. It makes you question how many of the international arrivals bring COVID cases in the Philippines. Ilan ba talaga sa mga dumadating sa Pinas galing abroad ang nagdadala ng COVID? How many international arrivals contribute to the COVID numbers in the Philippines? Now that question can be answered by the Department of Health's website, the COVID Tracker. So 5 days ago, I emailed the Department of Health. Can you give us the COVID number statistics on how many really of the international arrivals are contributing to the COVID numbers? But they haven't replied. I don't think they'll reply. So I took the time myself to go to their website to look for the information. Now here we are at the Department of Health website. All right, COVID Tracker. So this is where we can find all the numbers. You see? So as you can see, that the cases in the Philippines is really increasing. It's even higher than of last year. So, but our purpose for visiting this website is to filter how many of the international arrivals are COVID positive or bringing COVID-19 in the Philippines. Ilan nga ba sa mga umuuwi sa Pilipinas ang nagdadala ng COVID? So here, for different regions, let's filter ROF. Alright, so here we are, ROF, filtered. Oh, look. Look, guys. I was quite surprised too when I first opened this. Because it shows total cases from ROF is only 19,801. Active cases, 559. Recovered, 19,200. And unfortunately, we have 42 people who died. So as you can see sa graph naman for the COVID cases from ROFs, it was slow in the beginning of the pandemic because the inbound capacity at that time was very low. Ilan lang yung pinapapasok. But when they opened, oops, look at July is the highest. 704. Look, the highest they reached for 1 week, August 13 hanggang August 19, ROFs brought 828 COVID cases sa Pilipinas, right? But it went down. It was low in October, a little bit higher in December, and low again in January because this time, meron na sila mga bans. And then, yeah, we can see it's increasing for February, but not as high as like August. It's still low. And look, the latest data we have is for March 11 to March 17, 2021, but delays in reporting. So, okay, we'll not count this as the number because it's delayed. So, our latest, yung sure na talaga na data is itong March 4 to 2021 to March 10. That's for 1 week. Sa 1 week na yan, sa lahat ng pumasok, 448 lang yung COVID positive. And a good thing naman sa mga ROF na nagpa-positive ay they are in quarantine. These 448 cases are in quarantine. They are not in the community spreading the virus. Okay? So the cases of ROFs are isolated. So, kung i-divide natin yung nakalagay dito sa Department of Health, if we divide the ROF cases, these are overseas cases acquired, 19,801 divided by the total cases in the Philippines, it shows 0.3, okay? That's 3%. It means only 3% of the COVID cases in the Philippines is overseas acquired, is nanggaling sa ibang bansa, is nanggaling sa mga umuuwi. 3% lang po. At you can see naman, maliit pa rin po. Maliit pa rin. 382, that's for 1 week. And 448, it's increasing steadily. But that's for 1 week na po. How many people have gone home within that week? So how many people have gone home over the week? Okay, so this was the time when Manila still had 3,000. So 3,000 in Manila plus 1,500 in Cebu plus 1,500 in Clark. Let's assume the maximum capacity. So that's 6,000. So 6,000, let's just assume that's one day only. 6,000 times 7. Ito lang, I think it's very low. Very low. Maliit lang po yung cases na dinadala ng mga ROFs. We can say that hindi naman talaga sa amin nanggagaling, hindi naman talaga sa mga international arrivals nanggagaling yung mataas-taas na numbers ng COVID cases. Sinabi pa nga ni Dr. Pauline Ubial, right now, the major fuel of this surge is really household transmission. Instead of only 1 or 2 persons in the household getting COVID-19, as we've seen in the past year, it's now the entire household, like 10 or 12 people testing positive all at the same time. Kasi meron din mga nagpa-positive na ayaw nilang ilipat sila sa government isolation facility. They want to stay at home, especially those na walang symptoms. They don't want to go sa isolation facility. They want to stay at home. Now, tell me, if you live alone, then that's fine. But if you live with your family members, you share the bathroom, you share the kitchen, you know, it's just gonna spread. It's just gonna spread in the household. So based naman sa data ng Department of Health, napakaliit lang ng COVID numbers ng Philippines are coming from international arrivals. And even the variants, yes, initially they were coming from overseas, but now they've already been in the Philippines. The cases are coming from local na. Local na po. So for now, yes, we have the travel cap of 1,500. Yes, we have suspended the entry of balikbayans and foreign nationals with visas. Okay, that's for 1 month. But what happens after that? Are we just gonna go back to the 3,000 maximum capacity in NAIA and then 6 days hotel? As we can see, it's not working. The quarantine hotels are congested. OA is depleting because they cannot afford this, man. It's too expensive for this agency. So, Philippine government, my question is, what's your plan after April 19? What is your plan? How are you going to address the congesting hotel quarantine facilities and the depleting OA budget because of the prolonged hotel quarantine period? You guys, what do you think should the government do? They have to strike the balance between keeping people safe and having practical protocols that they can afford. So this is all for this video, friends. I'll see you again, and I want to read your suggestion. I'll see you with another travel update. Bye.